Question 1. Domain, airway, respiration, and ventilation. You respond to a 56-year-old found unresponsive on the couch. He has snoring respirations at 8 breaths per minute and a pulse. What is the most appropriate immediate action? A. Apply a non-rebreather mask. B. Insert an oropharyngeal airway and ventilate with a BVM. C. Perform chest compressions. D. Suction the airway only. Correct answer, B. Explanation: snoring respirations indicate airway obstruction and inadequate breathing. An OPA with BVM ventilation is indicated when the patient is unresponsive with a pulse. Question 2. Domain, airway, respiration, and ventilation. A conscious patient with asthma is wheezing and speaking in short sentences. Respirations are 28 per minute. SpO2 is 91%. What is the best initial oxygen delivery method? A. Nasal cannula at 2 liters per minute. B. Non-rebreather mask at 15 liters per minute. C. Bag valve mask. D. Venturi mask. Correct answer, B. Explanation: a non-rebreather provides high-concentration oxygen for patients with significant respiratory distress who are breathing adequately. Question 3. Domain, airway, respiration, and ventilation. Which finding most strongly indicates respiratory failure rather than respiratory distress? A. Wheezing. B. Tachypnea. C. Altered mental status. D. Accessory muscle use. Correct answer, C. Explanation: altered mental status indicates hypoxia or hypercapnia and impending respiratory failure. Question 4. Domain, airway, respiration, and ventilation. A patient has shallow respirations at 6 per minute with cyanosis. What is the priority intervention? A. Administer oxygen via nasal cannula. B. Apply CPAP. C. Assist ventilations with a BVM. D. Encourage deep breathing. Correct answer, C. Explanation: inadequate respiratory rate requires assisted ventilation with a BVM. Question 5. Domain, airway, respiration, and ventilation. Which patient is the best candidate for CPAP? A. Unresponsive trauma patient. B. Hypotensive patient with vomiting. C. Alert patient with CHF and pulmonary edema. D. AAPA-no patient. Correct answer, C. Explanation: CPAP is indicated for alert, breathing patients with respiratory distress, such as CHF-related pulmonary edema. Question 6. Domain, cardiology, and resuscitation. You find an adult patient pulseless and apneic. What is the first action? A. Apply AED. B. Begin chest compressions. C. Check blood glucose. D. Ventilate with a BVM. Correct answer, B. Explanation: high-quality CPR with chest compressions is the first priority in cardiac arrest. Question 7. Domain, cardiology, and resuscitation. When using an AED, when should compressions be resumed after a shock? A. After checking a pulse. B. After ventilating twice. C. Immediately after the shock. D. After analyzing rhythm again. Correct answer, C. Explanation: compressions resume immediately after shock delivery to maintain perfusion. Question 8. Domain, cardiology, and resuscitation. Which sign most suggests cardiogenic shock? A. Warm, flushed skin. B. Bounding pulses. C. Hypotension with pulmonary edema. D. Fever and tachycardia. Correct answer, C. Explanation: cardiogenic shock presents with pump failure and pulmonary congestion. Question 9. Domain, cardiology and resuscitation. Which patient should receive an AED as soon as possible? A. Unconscious patient with a pulse. B. Patient in respiratory distress. C. Pulseless apneic adult. D. Bradycardic patient. Correct answer, C. Explanation: AED use is indicated for pulseless apneic patients. Question 10. Domain, cardiology and resuscitation. Chest compressions in adults should be performed at what rate? A. 60 to 80 per minute. B. 80 to 100 per minute. C. 100 to 120 minutes. D. 140 to 160 minutes. Correct answer, C. Explanation: guidelines specify 100 to 120 compressions per minute. Question 11. Domain, trauma. During the primary assessment of a trauma patient, what is the first priority? A. Obtain vital signs. B. Control life-threatening bleeding. C. Perform a detailed head-to-toe exam. D. Obtain patient history. Correct answer, B. Explanation: life-threatening bleeding must be controlled immediately. Question 12. Domain, trauma. A patient has a flail segment on the chest wall. What is the most appropriate management? A. Apply bulky dressing. B. Administer high-flow oxygen. C. Stabilize the segment and assist ventilations if needed. D. Apply ice packs. Correct answer, C. Explanation: flail chest impairs ventilation and may require assisted breathing. Question 13. Domain, trauma. Which sign indicates possible internal bleeding? A. Hypertension. B. Bradycardia. C. Cool, pale, clammy skin. D. Bounding pulses. Correct answer, C. Explanation: signs of shock suggest internal hemorrhage. Question 14. Domain, trauma. A patient was ejected from a vehicle. What is the most appropriate spinal precaution? A. Soft cervical collar only. B. Full spinal motion restriction. C. No immobilization if alert. D. Encourage patient to sit up. Correct answer, B. Explanation: high energy mechanisms require full spinal motion restriction. Question 15. Domain, trauma. Which injury has the highest priority for rapid transport? A. Closed tibia fracture. B. Isolated arm laceration. C. Penetrating abdominal injury. D. Minor head abrasion. Correct answer, C. Explanation: penetrating abdominal trauma is life-threatening. Question 16. Domain, medical emergencies. A diabetic patient is confused and diaphoretic. What should be done first? A. Administer oral glucose. B. Check blood glucose. C. Give oxygen. D. Transport immediately. Correct answer, B. Explanation: blood glucose must be checked before glucose administration. Question 17. Domain, medical emergencies. Which sign most suggests hypoglycemia? A. Hot, dry skin. B. Fruity breath. C. Altered mental status and diaphoresis. D. Deep, rapid respirations. Correct answer, C. Explanation: hypoglycemia causes sympathetic responses such as sweating and confusion. Question 18. Domain, medical emergencies. A patient with a severe allergic reaction has swelling of the lips and tongue. What is the priority concern? A. Hypoglycemia. B. Airway compromise. C. Dehydration. D. Infection. Correct answer B. Explanation: anaphylaxis can rapidly obstruct the airway. Question 19. Domain medical emergencies. Which patient is experiencing a stroke? A. Sudden unilateral weakness and slurred speech. B. Gradual headache for 3 days. C. Chest pain radiating to arm. D. Fever and stiff neck. Correct answer A. Explanation: sudden neurologic deficits indicate stroke. Question 20. Domain medical emergencies. For a suspected stroke patient, what is the most important information to obtain? A. Blood pressure. B. Past medical history. C. Time symptoms began. D. Oxygen saturation. Correct answer C. Explanation: time of onset determines eligibility for stroke interventions. Question 21. Domain EMS operations. What is the first step in scene size-up? A. Determine patient complaint. B. Ensure scene safety. C. Obtain vital signs. D. Begin treatment. Correct answer B. Explanation: EMT safety is the first priority. Question 22. Domain EMS operations. Which action best reduces the risk of back injury when lifting? Bend at the waist. B. Keep the load away from the body. C. Lift with the legs. D. Twist while lifting. Correct answer C. Explanation: proper lifting technique uses the legs, not the back. Question 23. Domain EMS operations. When should the incident command system be used? A. Only during disasters. B. Only during fires. C. Any time multiple responders are involved. D. Only when law enforcement is present. Correct answer C. Explanation: ICS improves coordination whenever multiple responders are present. Question 24. Domain EMS operations. Which situation requires the use of standard precautions? A. Trauma only. B. Medical calls only. C. All patient contacts. D. Only known infectious patients. Correct answer C. Explanation: standard precautions apply to all patients. Question 25. Domain EMS operations. Which document legally records patient care? A. Dispatch log. B. Incident report. C. Patient care report. B. PCR. D. Refusal form only. Correct answer C. Explanation: the PCR is the legal medical record of EMS care.